My name is Martel Hesketh. I am a member of the Michelle First Nation from Treaty 6 territory in Canada, but I grew up on Coast Salish territory in Washington State, and I currently work as an evaluator at the Urban Indian Health Institute, where I get to work on a variety of programs, but all of them we approach using our Indigenous evaluation framework and methodology. So how we approach evaluation and research at Urban Indian Health Institute is we start with the fact that Native people and Indigenous people have always done evaluation and research. We were the first researchers on this land, and that hasn't changed. We know that our communities still have the knowledge, skills, and abilities to conduct research and evaluation. And when we think about the ways that our ancestors have been doing this since time immemorial, there are just countless examples, whether that is thinking about the Three Sisters and intercropping corn and squash and beans together. And if you think about the amount of knowledge that took, the relationship with land and place, probably the many mistakes that happened over generations, and to perfect those systems, that takes a ton of science in those different iterations. And then we also pass that knowledge down. So we think about evaluation and research as continuing those traditions of collecting information, sharing it back with our communities. And all of that is for the purpose of taking care of each other, for taking care of the health and well-being of our communities, of our Native communities. So when we think about creating evaluation tools and plans for communities, we are really centering the community throughout the entire process and figuring out how we can make it easiest for the community members themselves to participate in it, and whether that's integrating it into activities or making sure we're able to compensate people for their time if they're sitting down and talking with us. But that also means in the selection of the specific evaluation tools, it's not we just, always use talking circles and that's Indigenous evaluation. It's thinking about what are the specific tools that best fit the needs of this community and the stories that they want to tell. Because if you're able to align those, what stories you're collecting and sharing out with those stories that the community knows are the important ones to share out, they're also going to be more motivated to participate. And I think about how my Native ancestors didn't always carry all the tools they ever built with them as they migrated from summer camp to winter camp, right? They used what was in place around them and adapted that to best fit the needs of their community. So similarly, we'll think of different tools and adapt them to meet the needs of our communities or the program goals as well. And in this particular project, one of the big questions that this community of educators has had for a long time is, how is this work spreading? We're always showing how diseases can spread throughout communities, but what would that look like then to show how good work and good knowledge and good health is spreading throughout our Native communities through this Indigenous plants and foods work? So in thinking about that, we used a social network analysis tool to be able to document those relationships, because we also know, and our communities know, that the relationships that we have with one another is such a strength for us. And that was a really important way that this good knowledge and good health gets spread throughout our communities. A big barrier that we encounter when trying to do Indigenous evaluation work, and one that so many of our partners, when also trying to implement this work, encounter, is just funders that don't understand what it is, or are asking folks to collect metrics that make no sense for their communities. And it takes a lot of walking in these two worlds to be able to do that, to be able to both collect the, what your funders want, as well as to be able to collect the stories that then will help you improve your program or be able to share back with your community, who are the people that should be accountable to for these programs, or those that they're meant to serve. So definitely getting funders to understand the value and impact of approaching evaluation in these traditional ways. It also does take a lot of time. A big part of it is making sure that you can have those relationships with community. So different ways to do that, or like to overcome that, or to be able to hire folks from the community to do this work, you don't need a master's degree to collect really important, valuable information about a program or a project. Or making sure that there are community members that are in decision-making seats within this project as well. But all of that requires a lot of time. It requires more money. It requires working on the community's time frame, which doesn't always align with your 5-year project plan. So there's definitely flexibility that's required within that. Is another barrier that we encounter is of these grants or funding mechanisms that completely separate like environment from health, or separate traditional ecological knowledge and spreading that from the health and well-being of our communities. For some of this work in our reports, I can't write like health is our outcome, even though if you show it to our communities, our elders know like, oh yes, this is spreading good health and well-being amongst our community members. So definitely those like colonized systems that separate all these topics and put them into a bucket is just always clashing with Indigenous ways of knowing how everything is related, how the health of our knowledge systems is related to our physical health and well-being as a community, and that reflects it in the epidemiological data that we report on to these other funders. So it's all connected, but that can be hard to try and pretend it's not when we're talking about it at times. I think what this project means for me personally is just being able to celebrate and show what our communities can do when they're given the resources and like allowed to do this work in the ways that they know, in ways that are founded on traditional values, and to see just the excitement and growth around that. It's like the most effective public health intervention that I've seen, and it's just really exciting to celebrate that and to really focus on sharing that back with our own communities, not trying to convince others that we know what we're doing or that this works, but just share amongst ourselves and celebrate, and hopefully help that work continue to grow.